Just days after a deadly, unprovoked attack in downtown Vancouver, BC's premier says it's time for change.
We know that the current response that we offer is not adequate.
Police say the accused had a long history of mental health issues, the latest in a series of violent crimes, often fueled by toxic drugs.
It is costly for the people struggling with these conditions. They are not safe. And increasingly, I'm concerned that the way that they are interacting in our communities is making everybody less safe.
Now, the province plans to expand its involuntary care program for those with addictions issues by opening highly secure facilities to house people detained under the Mental Health Act. The province plans to add more than 400 hospital beds exclusively dedicated to mental health, some new, others refurbished.
I know that this group of people will be healthier, will be safer, will be better cared for in a supportive environment than they will be wandering the streets of our communities and dying.
In another shift to the NDP's approach to substance abuse, the province attempted to decriminalize some hard drugs, but scrapped it midway through the pilot project. It also comes a month before the provincial election. Eby's main rival, the leader of the Conservative Party, calling for a similar policy last week.
We need to bring an end to this epidemic or this terrible situation we have right now with addictions in BC.
But critics warn there's not enough proof involuntary care works.
I have seen no literature, no compelling literature that involuntary care is effective for young people, for marginalized populations.
Despite this, people like the parents of Brianna McDonald are demanding it. They lost their 13-year-old to drugs. She died after being discharged from medical care against their wishes.
I can't even imagine what her parents are going through. I think it's every parent's worst nightmare.
Eby says his changes will save people too unwell to save themselves. Yvette Brent, CBC News, Vancouver.